public health specialist is not correct.
Welcome back. Now we are looking, we'll be looking at a silent public health crisis that is costing the country billions in lost productivity. We are looking at eye care in the country. And allow me to just mention something. The Ministry of Health, a staggering 30% of Kenyans are currently in need of eye care services, but beneath that number lies an even more indicative statistic that the national refractive error coverage stands at nearly 6.7%. Daktari will be giving us the exact ones. That means that out of every 100 Kenyans who simply need a basic pair of prescription spectacles to see, work or read, 93 of those 100 will go completely without. Of course, we have a number of eye conditions in the country. Some are even preventable, but that and much, much more. Allow me to rope in my panelist right at the moment. She is an ophthalmologist and public health specialist from the Ministry of Health headquarters, Dr. Vivian Ongore. Welcome to the program.
Good morning. Thank you.
Morning.
Yes.
We had a panel of 6 people.
Yes.
And 4 of them had spectacles.
Yes.
I actually don't like them, but this year I also became part of the statistics that how prevalent is eye conditions in the country, and where are we in comparison to other countries? Because we've had issues with cataracts, we've had issues with the services themselves are not as widespread as they should be.
Okay, thank you very much for that question. Yes, I did notice that more than half of the panelists were wearing spectacles.
Yeah.
And this is in line with what our national statistics say about refractive errors. Mm-hmm. We did a study, a national study about 2 years ago on causes of visual impairment and blindness. Mm-hmm. By blindness, I mean somebody who cannot walk and has to be assisted to do daily activities. By visual impairment, I mean blurry vision that is not perfect. So I would equate it to somebody looking through a screen, their windscreen on a rainy day. Mm-hmm. So uncorrected refractive errors, that is those who require spectacles. Spectacles as one of the main modes of correction of refractive errors. This was the #1 cause of visual impairment in the country. Mm-hmm. Having said that, there are different types of this. There's long-sightedness, there's short-sightedness, and there's an age-related change in vision known as presbyopia.
Presbyopia.
Yeah, where the person requires near vision correction or glasses to read. So looking at the panelists,
yes, millions of Kenyans are watching. Where exactly age related by maybe?
So for the age-related change, it is those above 40 years old. They require glasses to read and to perform near work, such as maybe beadwork or sorting out rice, and it's not solely reading. And so at 40 and above, then age-related refractive correction is required. Near correction is required. However, in the other age groups, there's also refractive errors. In children, it is present, and this is of concern to us. And even in the working population, it is of concern to us. It's for children, it affects their learning. The children with the refractive errors learn half as much as their peers. And then the adult population, it has implications in road traffic accidents, in accidents at the workplace. It has implications in this, and it has implications in productivity. Yes.
I'm also looking at some of the issues that we have in the country in terms of cataracts, because I see cataracts account for nearly half of all blindness in Kenya. But before we do that, I had to go to an ophthalmologist, have my eyes checked, and then I was prescribed these spectacles. But how many Kenyans are able to do that? That was my first time, actually. And I've been on this planet for a number of years, but that was my first time. And I can't be able to afford that. How many Kenyans cannot be able to access these crucial services?
More than 500,000 Kenyans are not able to access eye care services at the moment. We do have a shortage in terms of human resource, in terms of specialists that can address eye care problems of various types. But as a ministry, we are working towards universal health coverage, which is that we want to ensure that individuals get access to quality health services, at an affordable cost or at low cost. So as a ministry, we have employed various modalities to bridge the access gap. So by access, there's the issue of unavailability of the services, there's the issue of personnel, and there's the issue of cost in terms of accessing eye care services. So we are employing our primary healthcare approach to bring healthcare to all the hospitals. There are levels of hospitals in the country. There's level 3, which is the big hospitals, level 5 and 6, which are the big hospitals where you would traditionally find a specialist. Then there are the lower levels, the health centers and the dispensaries. And then the level 1, which is the community health promoters. So we're trying to bring health down to all the levels, through the primary healthcare approach, so that somebody can access the healthcare services without necessarily having to go to the highest level to get the ophthalmologist. We are also involved in a multi-sectoral approach. We have school screening programs where we are using the schools. We are getting healthcare workers and the teachers to work together to screen children, mainly in the public schools, to address the issue of refractive errors and eye disease in a bid to increase access to eye care services. Yes.
And from your data from the Ministry of Health, about 7.5 million Kenyans are dealing with various forms of visual impairment.
Yes.
And shockingly, more than 80% of these cases are completely preventable and treatable.
Yes.
Let's get to those conditions which are preventable and treatable, because they really don't need a lot of concerns, not like operations and everything.
Yes. Yes, so you're correct in saying that 80% of the eye conditions are preventable and treatable. So I'm going to start with treatable, because now there we are talking about our top 10. The number 1 is cataracts, and number 2 is glaucoma. Then after that, we have allergy, refractive errors, and corneal disease. So as you age, and it is treatable through surgery. It's usually a 30 to 40 minutes surgical procedure where the natural lens is replaced by an artificial lens, and the vision goes back to normal. The success rate is very high. This is our number 1 cause of blindness in the country. The second one, glaucoma, is not really, let me say, partially treatable, because it is irreversible. Once you get glaucoma, your visual impairment or your blindness is irreversible. And I want to say here that many of the eye conditions that affect Kenyans and the elderly and that cause blindness are painless. So Kenyans are generally used to coming to the hospital when they're in pain, when they feel pain, or when they are blind, or late stages. But in the eye, most of them are painless. So screening, screening for the diseases is important beforehand to prevent advanced stages of the diseases. The other thing that's coming up is the rise of non-communicable diseases in our setup, hypertension.
Allow me just a minute to take you back to what you've said about screening.
Yes.
How frequent should it be?
It should be every year if you are above 40, and if you're below 40, once in 2 years.
Okay.
Yes. Yes.
Yeah, now you can continue.
So I was talking about the advent of non-communicable diseases, hypertension and diabetes are the top are the two top non-communicable diseases that are assailing the population at the moment. And there are complications associated with them in the eye that may lead to blindness, diabetes especially, and even hypertension. So for this, with this reasoning, then we advise screening. We're still emphasizing on screening, especially those who are diabetic, those who are hypertension. They need to be screened yearly. And even for the health workers out there, if you are seeing patients, as you do your medical check, ask them to see the eye specialist. In your diabetic clinic, in your hypertensive clinic, ask them to be seen by the ophthalmologist or the eye health specialist. Another thing that's also coming up is technology. Technology and screen time, use of the screens.
Yeah.
We use them at work in our professions, and then also our children are using the gadgets a lot, and we are exposing them to increased screen time.
Yeah.
This also has an effect on vision, and it also has led to an increase in refractive errors, short-sightedness in the children. It hampers the development of the eye to a level that they are not able to, they become short-sighted. And we are seeing a rise in refractive errors in children because of screen time. Yes.
And also, I'm looking at, let's look at education, the clear link between poor school performance and undiagnosed vision in young learners.
Yes.
What simple protocols or should primary school or even schools adopt so that parents also can also be able to distinguish whether my child is having struggling to learn or my child simply cannot see the blackboard?
Okay.
Because it's affecting the school performances.
Okay. Yes. So, I'll tackle it in. I'll categorize it into parents and teachers. So there are the general signs of refractive error that children present with. They squint their eyes, they squeeze their eyes to see. Some will bring their books closer to their face, or more often bring their faces closer to their books. And this is a child who has visual impairment, they're struggling to see. And then commonly what you see at home is your child going to the TV. They come close to the TV. Instead of watching it at a distance, they come close to the TV. This should tell you that there's a problem with their vision. But for some of them, it just translates into poor performance, and the teachers don't know why the performance is poor. So I would advise yearly checks if there's any suspicion of this, or even without suspicion of visual impairment, because some of these errors are picked, especially when they're not very high. They are picked at by a healthcare professional, and I still stress the screen time, less than an hour a day for your children. I know people use it to distract the child as they do their laundry, as
actually,
they
that would be an issue.
Yes. So just understand that it hampers their development in many areas, not only in the eye, in many areas it hampers their development.
From the Ministry of Health perspective, because while I was doing the research, I've discovered that specialized care is heavily concentrated in 40 of the 47 counties and primarily in urban centers. How can we decentralize your profession, ophthalmology, opticians? How can we decentralize this? Or are there any plans by the Ministry of Health to ensure that these centers are even in the list of the list of corners of the country? Okay.
So yes, you are correct that most of our healthcare services or the eye care services are centered in the urban areas. And however, I want to say here that in our counties, about 40 of them at our level 5s, you can get eye care services. There are ophthalmologists there or an eye care. Yes. That is the current statistic. The other thing is that I mentioned earlier that we have partners. We have partners involved, and also the county governments involved in outreach programs, where we do a medical camp at a certain village or at a certain school to reach many more people than those who would come to the hospital. So we have programs on this where we are reaching the community at their level. The thirdly, I also talk about what I had mentioned earlier, primary health care, where we are trying to bring the services down. Not necessarily that it has to be, the consultant at the top providing the services, that we want the minor eye conditions to be managed at our lower levels. And we have programs for this to bring the healthcare to the lower levels. We would like to train even other health workers to be able to pick up eye conditions at the lower levels, because we found that access is a problem. We also have the community health volunteers, promoters, who are a very important resource in advocacy and also in picking these eye conditions and ensuring for follow-up of the conditions. And so we have come up with content. There is a program that the community health promoters use to assess their community. They assigned households and they assess people in the communities. So we are trying to rope in the community health promoters, get the healthcare to the primary healthcare level, and then also strengthen equipment and training at the higher levels as well.
Yeah, I'm also looking at the cost itself, because the cost is a bit high.
Yes.
And especially for premium ones, for premium Miwanis and everything. How can we bring it down? In as much as we are talking about many Kenyans can find these services at level 5 if you don't want to use the private companies. How can we bring the cost down of eye care?
Of eye care specifically, or of spectacles?
Both. Because both go hand in hand like traffic and weather. Okay.
For eye care, one way of reducing the cost would be to have the services available. First of all, in the public domain and in the public space. Yeah. So for a long time, spectacles, even as we speak, have been a preserve of the private sector, and anything that is private is usually more expensive, isn't it? Yeah. If you're taking your child to a private school, you'd pay more, right? Yeah. If you're doing private transportation versus taking a matatu, it would always be more expensive, isn't it? Yes. So to reduce the cost, and we want to bring the healthcare more, the eye care services and the spectacles to the public sector. In a bid to do the same, we are trying to increase the number of optometrists. Optometrists are those who prescribe glasses. To increase their employment within government, number one. Then number two, we also have programs to bring glasses to the counties, and we did distribute spectacles to some of the counties. I think 40 out of 47 counties received glasses, so that you were able to receive glasses at the government facility. And then other modalities are there that we are still working upon, using AI. Using artificial intelligence to do something called telerefraction, where you are seen remotely. You're seen remotely and then referred to the healthcare system to get the glasses. So we are still exploring some of those modalities. Yes. And
of course, I think giving incentives to maybe companies that import something, maybe that could work, because if we bring down, for example, the cost of maybe frames and the cost of lenses, if we offer incentives to people who are bringing them in the country, I'm quite sure we can also bring down the cost of
Yes, we are working on that. And through that program, the one I'm telling you, where we distributed the glasses, actually the cost came down quite a bit. Yes.
Yeah, and there was a conference. There was supposed to be a conference in regards to this, maybe to share more awareness. Yes. And also bring to light some of these conditions that we didn't know were taking away a lot of sights, both children and even the aged.
Yes. As a country, we are proud to be the first country in Africa to host this conference. It's an International Agency for Prevention of Blindness conference, which is coming up. It shall take place from the 4th to the 6th of May. And as I said, it is the first time that this is happening in Africa. And our aim is to strengthen, the aim of the conference is to strengthen collaboration, to unlock investment, and to amplify innovation, to increase access to eye health in the country. It shall bring together global health institutions. There shall be some global leaders in attendance. We hope our leaders shall be able to attend. Policy makers and NGOs, as well as researchers and eye health professionals, shall be in attendance of this conference. Yes.
What about Kenyans? Can anybody attend, or is more or less like a stakeholder meeting? Conference?
At the moment, registration has closed. It closed on Friday.
Okay.
But yes, anyone.
When is it?
Between 4th and 6th.
4th and 6th of this month.
Of 4th and 6th of June at the Radisson Blu Hotel, Upper Hill.
Yeah, I'm also looking at how many students are pursuing a career in eye-related ophthalmology, opticians, technicians, and especially in our TVETs, because one of the issues that we have in the country is shortage of doctors, whether they are dentists, whether they are cardiologists, but we have a shortage of doctors.
Yes.
Are we also ensuring that when it comes to, because you're the ministry, when it comes to technical vocational centers, and also are we also inculcating this in our curriculum to ensure that we have more ophthalmologists, because as you said, the blindness is on the rise.
Yes. Okay, it is on the rise, but I want to also say that our study showed that it came down from 0.7% in 2020 to 0.37%. Yeah,
but
over time.
Comparing 5, 10 years.
So yes, it's still, we still do require a lot of human resource, as you've correctly said. So for as regards training, we do have a number of institutions training eye care workers. We have the University of Nairobi that trains ophthalmologists, and we also have other institutions under the COEXA program that are also training ophthalmologists. Like Moi University is training ophthalmologists as well. So we've increased the number of universities that do train ophthalmologists in the country. We also do get ophthalmologists trained even outside the country via the county governments. We have ophthalmologists who are being trained outside the country as well. But within the country now, for the other cadres, we have KMTC, that trains ophthalmic clinical officers who do cataract surgery. They do surgical management of eye conditions, and they also do train ophthalmic nurses. And we have Masinde Muliro training optometrists in the country as well. Still, the numbers are still not adequate. We are still not adequate, even with all these training institutions. But this is something in progress. We still have the institutions in place. So we are trying to increase the numbers. Yes.
I'm also looking at the universal health coverage as we aim to be fully health to be universally available for everyone. And we have the social health authority. How much does it cover when it comes to matters eye care? Does it cover comprehensively?
Yes, so for the Social Health Authority, it covers all surgical procedures. It will be at no cost to the person who has paid up.
It's a good thing that you're saying this, but unfortunately many Kenyans don't know this.
Yes, for the surgical procedures, for a cataract, if you need a surgery, SHA will cover you fully if you are paid up. For the spectacles, we are still working on the package. You're still in conversation to share on the package. It covers one family member for 950 shillings. That one we are still working on it because it's not quite adequate. We also have the primary healthcare fund. Primary healthcare fund covers healthcare at the lower levels, dispensaries and health centers. And this is at no cost to the patient. So this is why we are trying to bring our eye care to that level so that Kenyans can access this at no cost. Yes.
And because of the interest of time, I would like to know, I'll just ask one thing. What should we be looking out for? Yes, I know the Ministry of, as the Ministry of Health, you've said that we are also looking into how we can, better the package of eye care on SHA.
Yes.
What else in regards to eye care should Kenyans expect, especially in the coming year?
Okay. So in the coming year, we are
talking about financial year because
financial year.
Yeah, because we are starting it in the next couple of days.
Okay. So as regards eye care, there'll be a lot of push and a lot of programs towards alleviating cataracts. We are working with a certain partner to improve cataract services access within the counties, and this is will be actualized in several of the counties. Then we are also working towards improving quality of the eye care services, quality of surgeries, quality of the refractive refractive errors, coverage. So we have programs to retrain some of the healthcare workers within our facilities. Regarding spectacles, there are several programs on this. We already have many programs within the city, in Nairobi and outside the city, where they're doing refraction in various localities for those who would like to come at no cost. Then we are doing a lot of school health programs, and this will continue. It's already ongoing, but we expect a lot more of this as we go forward. I want to say that we have set targets for ourselves on this, or rather they have been set for us by WHO. WHO would like us to, you talked about 6.7%, which is a very low figure, and we would like to increase that coverage, refractive error coverage, those who can get glasses, by 40%.
That's an ambitious
by 2030. Very ambitious. How many years do we have?
It's just like 3.5.
Yes, we would like to increase the coverage to 46.7% by 2030 of the refractive error coverage. So we've really vamped up our efforts on that, using multiple stakeholders and multiple partners. Yes.
Your final comments, and also give us some tips, eye care tips.
Okay.
So many people ignore them, just like I ignored, but I was it caught up with me.
Okay, my final comments. If you are above 40, have your eyes checked every year, because several of the eye conditions are preventable and painless and require screening for diagnosis. If you have a child, especially under 2 years, let them not use their phones and their tablets all the time. Let them play outside with the other children for development. For the children older than that, 1 hour a day is enough.
And allow me to ask this question, because since we were young, we were being told, don't be so close to your TV, you're going to lose your eyesight. Don't. Okay, now, because we didn't have devices now, now we are telling our kids not to be on their gadgets for extended durations of time. What are some of the dangers of this as we wrap up?
So the dangers of
a lot of screen time
for children is, let me explain it in terms of how the eye develops. The eye develops all the way until 12 years. At the time of birth, the eyes are not fully developed and the vision is not fully developed. So as they grow older, the eye development continues. And for the eye to develop, one has to look into the distance. So that they develop that muscle memory and the memory of looking at distant objects. So what happens with the screen time is at the time when the child is developing, when they're less than a year old, and you're exposing them to the screen, then they don't get to exercise distance vision. They don't get to exercise looking into the distance. And so their brain normalizes their vision at near. But looking into the distance is an important skill just in daily life. Almost everything is distance, yeah, just in general life for a normal adult, yeah. So for them, they need to really look into the distance. And this is how we developed, those of us who grew up playing in the estates.
Yeah.
You see, play involves looking into the distance. Someone has thrown a ball at you, you want to duck that. Yes.
Yeah. Well, thank you indeed so much, Dr. Vivian Ongore, who is a consultant ophthalmologist and also from the Ministry of Health, just putting it to perspective, eye care in the country. And I've learned a lot, if you haven't. I've learned a lot in regards to we should take great care of our eyes. As a parent, always observe how your kid is reacting, because sometimes they do not even know it's an issue of the eyes. So you'll find the kid is taking things a little bit closer, or even some of the colors in your eyes that are not normal, and also keep your eyes clean. Just like we said, 40% of these conditions are not only preventable, but they are also curable. Well, that is where we put a cap on News Check this afternoon. Is exactly 12 minutes. Thanks indeed for joining us. My name is Bentro Enjoy, and thank you, Dr. Vivian.